Okay, let's unpack this. It feels like the health system is getting hit from two sides at once.
It really is. You've got this massive internal pressure on the workforce, and at the same time, this external threat of diseases we thought we had under control.
Exactly. So today we're looking at the data, trying to connect the dots on why so many nurses are leaving and why something like whooping cough is suddenly spiking.
And that nursing problem, the scale of it, is, well, it's staggering. In 2023, the national average for turnover was somewhere between, 8.8% and a truly alarming 37%.
37%, that's huge.
It's massive. And the key thing here is that this isn't just a post-COVID shock. The sources show that this trend was already climbing.
Right, this started pre-pandemic.
Yes. Between 2006 and 2018, turnover for new nurses in hospitals went up by over 30%. So the system was already cracking.
So COVID was just the thing that broke it wide open. When you see a number like 37%, you have to ask, is this everywhere? Or are places with, say, better pay and schedules managing to avoid it?
Well, the data suggests it's more structural. Compensation is always a factor, of course, but it's not the main reason people are quitting.
So what is?
It really comes down to systemic issues. The biggest one is insufficient staffing. It just leads directly to exhaustion, to burnout, and it puts patient safety at risk.
And I imagine a lack of support doesn't help.
That's the other major factor, a real lack of support and recognition from management. And then there's just the raw physical and emotional reality of the job.
The heavy lifting, the trauma.
Exactly. And the safety concerns. I mean, workplace violence is a documented serious problem.
Okay, so we have this internal crisis brewing, and then it collides with this external threat, this public health alarm.
The Pertussis surge, whooping cough.
Yeah, the numbers are just wild. So far this year, the CDC has seen over 8,000 cases. That's more than double last year's total.
And if that trend continues, we could be looking at 70,000 cases by the end of the year.
Which would be the highest number since the vaccine was first introduced in 1948?
That's right, since 1948. So you have to ask the question, why is this happening now? Why the return of a disease we basically controlled?
And the answer is complicated, I'm guessing.
It seems to be twofold. First, you have the behavioral side of things.
Meaning vaccination rates?
Yes. Vaccination rates for kindergartners have dropped below 93%. We used to be at 95%. That drop is largely driven by, misinformation and anti-vaccine sentiment.
And the second reason?
The second is biological. The current vaccine, the cellular one, is much safer than the old one, but its immunity doesn't last as long. It wanes.
So kids are losing protection faster.
Often by the time they even start school. Plus, we're now seeing the bacteria itself, Pertussis, starting to genetically mutate.
So it's a perfect storm. Vaccine compliance is down, and the vaccine itself is less durable. And this is a disease that can be fatal for infants.
And there's no real treatment. Antibiotics can stop you from spreading it, but they don't stop those violent coughing fits once they start. Vaccination is really the only effective tool.
So let's connect this back. What happens when a stressed, understaffed, burned-out ward has to suddenly deal with a spike in these cases?
It's a chilling thought. You're taking an exhausted workforce and adding this huge new burden. Caring for a baby with pertussis is incredibly intensive.
It must be.
It requires strict isolation, specialized PPE, constant supervision, all of which just cranks up the workload and makes the existing burnout even worse. And it pulls those resources away from everyone else.
So what's the solution? I mean, are there solutions? It feels like we're fighting a war on two fronts.
We are. And the solutions have to be on two tracks, too. For the nurses, organizations need to act now.
With what?
With things that actually improve their work-life balance. Eliminate mandatory overtime. Start real wellness programs. And yes, improve compensation and incentives. Flexible schedules, tuition help, things that show they're valued.
Okay, that's track one. What's track two?
Public health. Strict adherence to the recommended CDC vaccination schedules, DTaP for kids, Tdap boosters for teens and adults, and this is critical, a Tdap shot during every single pregnancy.
To protect the newborn from day one.
Exactly. That passive protection is their only defense. And really, that's where it all comes together. Knowledge is only valuable when you understand it and then apply it.
So when you think about it, these two things, the resilience of our healthcare workers and the public's willingness to follow prevention strategies, they basically determine the health security of the entire country. That's a powerful thought to leave you with. Thank you for joining us. If you enjoyed the video, you should subscribe to the channel, turn on the notifications bell, leave your like, and share the video because it helps us keep the channel going. Thank you.